Namaste. I'm Dr. Aman Priya Khanna from HexaHealth. Today we will discuss about how can I know if I have piles, fissure or fistula. So now let's come to fistula. Fistula is nothing but a tunnel in the anal region because there are glands which get infected, leading to an abscess. That means there is collection of pus inside. This abscess might burst out on the outside, causing a tunnel to form. So a fistula is nothing but a tunnel. Now this tunnel might have multiple types. It might be a simple fistula, it might be a complex fistula, it might be transsphincteric, intersphincteric. You don't need to get into the details. The important part to note is length, branching and location. How long is the fistula? Is there any branching in it? And what is the location of the fistulous tract opening? To make you understand what the treatment will be, and there are multiple treatments, and because there are multiple treatments, not one treatment is best for you. Laser might be very good for somebody else but not for you, or laser might be good for you and not somebody for else. A fistula might travel high up across the muscle fibers. That means it might cross the muscle. That means if we cut the fistula, there is a chance for injury to muscle. If there is injury to muscle, we might lose control of our motion. That's why this type of fistula needs to be treated by a very experienced surgeon. A fistula might be a small fistula just at the external region, and it's a simple fistula. A complex fistula might be branching. So if the fistula is branching, transsphincteric, simple, that's how we will decide which treatment is best for you. To understand the treatment options, which are various, and I'm not going to discuss all of them together, I'm going to tell you about laser, I'm going to tell you about open, and I'm going to tell you about Seton. Okay. What is laser? We discussed it's a very thin wire which has light energy or heat energy in it. So if within the tunnel I insert the laser fiber and burn it, it burns the tunnel. We take out or close the external opening, which is the outside opening, and we close the internal opening so that no stool can come from inside, and whatever material needs to come out from outside can come out and the body will heal itself. It's a very good procedure because there is no outside or minimal outside wound, but there is a very high chance of recurrence. The scary word in fistula. Let's understand why laser would lead to recurrence. If the fistula has branching like this, and we insert the laser fiber and we burn the tract, we might be able to burn this branching tract, maybe this one as well, but this and this might be left behind. Because this is a blind procedure. We don't know where the laser is going. We're only directed or given guidance by the light of the laser. So I insert the laser from the outside opening and try to see it from the inside where it's going. So the chances of recurrence in a complex fistula in laser become higher because we have left behind the tract. So is it good? Yes, it is good in cases where the tract is simple and small. It might be good because I don't want to injure the muscle if it's crossing the muscle, but there is a chance of recurrence. Should I give it a try? Again, it depends upon patient to patient. Let's discuss the open fistula treatment. So if there is a tunnel in the body, which is not needed and it should be removed, the ideal way is to remove the whole tunnel and send it off. If I remove the whole tunnel and my size of my fistula is about 4 centimeters, which is say this much or slightly higher, the wound or the external wound or the area that is going to be removed is going to be somewhere about this much, which will need daily dressings. Because there is a wound in the anal region, every day I pass stool, there is some discomfort for the patient. But like any other wound on the body, like if it's on an elbow or on the knee or anywhere else where I fall, I have a chort on my body, it tends to heal. First day might be difficult, second will be better than the first, third will be better than the second day itself. So every day the body is healing. That is why in some cases open fistula is the best treatment. But I said some, not all. Yes, there is a dressing needed. In some cases the patient is able to do it on its own. Sometimes there is a nurse needed. This dressing usually goes for a 3 to 5 week period. The first week, like I said, is difficult. The patient is in some pain because at the time of dressing, somebody is touching the wound, there is some pain, but that's the way the treatment is, and that is the best way that the recurrence goes down. Because I've removed the tunnel, even if it is branching tunnel, but I've removed the whole tunnel, that means recurrence is very, very, very low. Because I've removed the fistula altogether. Because if fistula is removed, there is no chance of it coming back. Let's discuss Seton. A Seton is nothing but a thread or a wire or a metallic wire. It can or cannot be compared to the Ayurvedic treatment of Shar Sutra, which is also a medicated thread, but this is categorized as a loose Seton. So let's understand why we need a Seton. If the tunnel or the fistula is crossing the muscle and I remove it, that means I am going to injure the muscle. So now I intentionally place a Seton or a thread or a wire in this fistula. Over a period of time, this wire will bring the fistula out because there is a wire here. Over a period of time, the fistula will just be outside the muscle will be preserved and there will be a Seton. Now I have preserved the muscle and the Seton has done its work to reduce the fistula. But this is over a period of time. So there might be multiple sessions of Seton. This Seton is classified as a draining Seton or a cutting Seton. Again, this might be useful for you, might not be. If one treatment or one disease has multiple treatment, so I repeat, if one disease has multiple treatments, there is no one correct treatment for all. That means one patient is best suited for laser, the other is best suited for Seton, the third might be best results with open. Let your surgeon decide which is best for you. So let's remember and recall why is fissure formed. It's a cut in the anal region. How was the cut formed? It was formed by tight, hard, constipated stool. Why do piles form? Because of long sitting, excess pressure and constipation. Can a patient with piles have fissure? Yes. Can untreated piles lead to fissure? Maybe no. But can a patient with piles who has constipation also have a fissure? Yes. Since we've answered this, let's understand, can a fissure, if untreated, lead to a fistula? So like we remember, the fissure is a cut wound. Just try to remember that this cut might have some depth. There is going to be some depth of this cut. The body wants to heal the cut. Body's normal response is to heal the cut. Once it wants to heal, but because the anal muscles are in spasm because of the pain, what happens is that this healing might happen on the outside, but there is a tunnel formed on the inside. So the fissure was a small cut, and now it has closed. Now it has closed on the top, forming a tunnel. Yes, so if a fissure is not treated, it can lead to a small fistula. So meet your surgeon, get diagnosed, and have the best treatment. Thank you.